Thanks, John.
Does that answer your question?
Yeah, that's great. We're going to transition now into roundtable discussion, starting with, I'll ask a question and then we'll walk through. The question is, going forward, how do you plan to use mobile technology, not just for COVID-19 management, but for also patient care? And we'll start with Colorado Springs.
Thanks, Chris. So we are certainly looking at expanding sort of integration of Pulsara into our pre-hospital medical care. As we work through this concept of tiered response in our community, we certainly look at an avenue where we could leverage the technology straight out of our PCEPs or 911 authority offices to connect a physician with a patient even before we dispatch a unit or a physical response. And then obviously we look at it for follow-up and follow-on care from the emergency department. So a lot of times we'll take care of a patient in our ER and we will discharge them, and maybe it's a wound or cellulitis or something simple that we just want to look at the next day. The patient app version of Pulsara is a great opportunity to ping the patient, create a quick 10-minute, 15-minute encounter to do some follow-up care. So those are two avenues Dr. Bronski and I are kind of exploring and looking at.
And this is Stein Bronski. As we mentioned before, we've been using Pulsara for about 4 years, and we started in a very narrow fashion, just using it for STEMI and stroke. And we have now realized over the last couple of years that the best way to function into the future, regardless of COVID, these conversations happened way before COVID, we needed a system-wide approach to advancing our communication. I think everybody struggles with having all these different modalities and chain links that can break. We see Pulsara as a holistic system of management, system of care solution that we are planning on expanding through the entire patient base, not just isolated to like strokes or heart attacks. And so we're actively already working on that and see that as the vision of our near future.
Great. And there was a question out there that said, how do patients have access to Pulsara from home? Are they registered beforehand? Do people register for Pulsara if they have no medical history? And the answer is, Pulsara can only be initiated by the provider. Our biggest concern was having patients always trying to get a hold of their clinicians. So instead, the patient receives a push notification from the provider. The app's downloaded in real time. It's authenticated, and then the telemedicine consult is started by the provider. And it's encrypted, secure, and from start to finish is a simple process, the same as downloading an app from the Google Play Store or Apple App Store, and can take as little as maybe a minute and a half to be up and running. So with our time, I'm going to actually jump to question 2 and have both Chris and John answer this one. Question number 2 is, please share your efforts on mobile integrated health or community paramedicine or any of the other unique programs your organization is completing.
Yeah, so we've been blessed to have a very robust community health paramedic program in our system for quite a few years now, and that program is continuing to grow yearly with more resources and more things that they're doing. They do quite a few things with the homeless community, as well as psychiatric patients or frequent callers, and also just folks that just don't know how to get the information they need, and you might not know how to get in contact with the right resources. So we have a pretty robust program already, and they've been doing a great job of doing this mobile integrated healthcare and working on getting folks to the right resource that they need, because a lot of times that's not an emergency room and they don't need an ambulance. going forward, I think that some of the benefits that come with Pulsara could really benefit that program, our CHP program as well, and that's something we're looking into going forward, of using it in that as well as for STEMI strokes and things like that coming in the future.
Yeah, here at Williamson County, we have a group of community health paramedics that are very interested in using Pulsara. These patients that they see on a regular basis are scattered throughout the county, and they may not be able to hit as many patients driving around from house to house. These are medically frail patients that maybe don't need to be seen in a hospital, and so they can probably reach out to more individuals using Pulsara. They can gauge whether they need to make a drive out to that place, to that patient's residence, and assess them there. But it gives them an additional tool to be able to reach out to this population of patients that we have, and could probably increase their workload without having to drive all over the county in most cases. But that's something they're very interested in doing with Pulsara. I know our Williamson County and Cities Health District is expanding its use as we've had a little bump in COVID positive patients here. And then we also can use it for maybe some alternate sheltering sites as well. So there's a lot of possibilities. We've brainstormed quite a bit of things that we could use, and it's just a matter of implementing those. The more immediate thing that we're doing is we have a core of what we call senior medical officers. And what we're going to be doing with them is we're going to have them use it on all calls, and just to kind of put Pulsara through its paces, and maybe even possibly eliminate a radio report with Pulsara. And we've reached out to all of our hospital partners here in Williamson County, and so far the reception has been very good. They're interested in it, they like it, and they're looking forward to what we're going to be doing with it in the future.
Thank you, guys. It's been super great. We were talking about communications and inefficient communications, and one of the bottom lines that I heard from Stein as he started out is when it becomes a MCI, or the active shooter, the stadium collapse, the bad bus rollover, or you set up a little bit higher to the disaster, the California wildland fires, the earthquake, the tornadoes, the hurricanes, or you even scale up to worldwide pandemic, it's really not the best time to take something off the shelf, dust it off, and start it. Instead, by using something that you use every day that can be scaled up and then scale back down seems to be the most appropriate. And with that, let's move on to AJ. Thank you.
Thank you. We have a couple questions in here. Back on the MCI side, can Pulsara be used to bring up multiple hospitals for information, for example, from a transportation area? Chris, I'll direct that one to you.
Just bear with us for 1 second. Chris is dialing back in. He got disconnected.
Okay. While we're talking then, this is used from a regular phone, right? You don't need a separate communications device, or do you?
That's right. Yep. It's just using mobile technology that everybody already knows how to use in the palm of your hand. So simple and easy to spin up, no proprietary hardware of any kind.
All right. Will any of the data or video images or forms flow into an EPCR platform? Is that one I got to wait for Chris on?
Yeah, it looks like Chris clarify on that one.
Okay.
Yep, and I'm on.
Chris, you're on. Can we use any of the data, video images, or forms and have them flow into an EPCR platform?
Oh, it's a good question. So technically, yes, we do have a public API, which allows us to connect with EPCRs. And we also built the entire system from the ground up at the beginning to be NEMSIS compliant for that opportunity.
Okay. Now we have a question here from Kelly Urban asking about in the pre-hospital environment, how have patients accepted the use of the app consultation via face-to-face response? Has it been favorable, or have you had issues with patients refusing this platform?
So this is Dr. Angelitis. I'll field that. By far and away, the most consistent responses are positive. People really appreciate the opportunity to teleconnect with a physician and have a real-time, patient-centered discussion. So I've found it to be very positive.
Yeah, and I'm just going to give you my perspective from AJ here, and that is that the COVID-19 pandemic has opened up the door, I think, for CMS, for reimbursement, for telehealth. So if you're not thinking about telehealth right now, you're going to be light years behind, because I don't think after the pandemic we're ever going to go back. We're going to still do. I have an appointment in 2 hours with an eye doctor over telehealth, so I don't have to go to the eye doctor. I'm going to be interesting to see how she checks my eyes, but other than that, I think that it's here to stay. Do any fire departments have cross-trained as paramedics use Pulsara? I think we're looking for some names for a fire department here who they can contact that use the program that's in the fire department. Certainly Colorado Springs.
Yes, sir. This is Stein Bronski from Colorado Springs. Our fire system is paramedic-based, and so anybody could contact us to talk about that. It has been working smoothly with our paramedics in the fire service since the day we initiated it. One thing I would like to add that has been popping up on the questions is, just how easy is this to use? Well, I'd be embarrassed to tell you that when we first launched Pulsara, we had multiple agencies to train, and the core agency, which was our fire-based medical response, didn't get the training, and we didn't realize it until the morning that we were launching. And within that one day, we were able to disseminate all of this and have the fire department paramedics using the application seamlessly because it's so intuitive and goes along so well with just everyday usage of a smart device.
Yeah, and let me just follow up, and I'm pretty biased because I'm a big fan of Williamson County and of Austin Travis County. If those two magnificent systems are using Pulsara, you can bet that it's been completely vetted, because their medical directors are absolute HIPAA and other clinical care. Colorado Springs, the same thing. Wonderful system, ahead of the game. So, Chris, I'm going to ask you to answer number 24. It's pretty detailed about the infrastructure and communication portability.
Yeah, it asks about the infrastructure and communications portability between systems. And really, it's based on mobile technology. And so the focus is, instead of having what big system is at the hospital, what big system is in EMS, well, we use PC-based, we're mobile-based. What we decided to do is say, listen, everybody has the technology they need in the back of their pocket. Let's make it secure. If I can take a photo of my bank check and the bank can deposit that check, if I can, with a couple taps, buy a pair of shoes and watch them be delivered all the way to my house, and of course my bank and my secure information from my bank was transmitted to that. If my mother, who's mid-60s, and my nephew, who's 3, can, without an instruction booklet, connect in real-time video using FaceTime, we should be able to do that in medicine. And we should be able to communicate seamlessly and simply using mobile technology. So it's actually platform agnostic, and there's very little IT lift on the EMS or the hospital side.
Yeah, we had somebody ask if we're going to do a hard stop because it's after 1,300 hours. The answer is no. We're going to go a few more minutes and try and answer as many questions as we have. If you have to drop off, you can see this archived, but we're going to continue for a few more minutes. Question, is there an EMR to Pulsara?
Yeah, and I think what they're asking, is there an EPCR
like
or an HR or a medical record? There isn't a medical record in that we are not a documentation system, but clearly we do collect data, right? You collect data when you got on scene, you collect data when you're integrating possibly with the heart monitor, you're integrating with that. And yes, we do allow all of that to flow out in a number of different formats. It could be the raw data, and a lot of EMS and hospital systems are looking at the raw data and then using that for their report reconciliation for accreditation or the CARES registry, so on and so forth. People can export as a PDF. And they also have instant visibility. So when the case is closed, what we're seeing is that, for example, the heart attack, the patients bypass the ED, they go in, they get their cath, the case is closed. The physician may take, or the cardiologist or the STEMI coordinator will take a photo of the heart before or after, and then put that into that case. And when they close it, everybody, including the crew on the EMS system, will get instant feedback. And of course, that's all in a database, and it's all on a dashboard so that the administrators at each place can track trends.
Okay, here's a really great question from Nina Hawk about, could Pulsara be used in a domestic situations for law enforcement or in law enforcement?
That is a great question. And the answer is by securely connecting with the right people at the right time, you can transmit any type of information, right? And so the opportunities in the future to expand in public safety beyond the EMS side for, scene and fire operations, for disaster MCI operations, for law enforcement operations, and emergency operations centers and dispatch, we're actually seeing some of that evolve even naturally with this pandemic.
So realistically, you could transfer over, for example, if you were in a living room and something was going south on a domestic violence call and the police were responding and didn't know what it was, you could technically open up a link so they could hear what was going on through their comm center doing a patch, right?
Yeah, this is one of those where somebody in the medical world says, there's a disclaimer, we're not advising you to use this medication, but it could possibly be used for that. And that's what we're seeing. We're seeing that by bringing in dispatch early and having them added to that patient channel, then we can connect and communicate with anybody. At this point, this has been primarily, and when I say primarily, 100% used in the clinical application, but for a potentially anybody to initiate that call, it's got to be from the provider or the law enforcement person connecting to that person.
Right. A question here, and I could even answer this, is Pulsara and use are available on the East Coast, like the New York tri-state area?
Yeah, AG, are you going to take that one?
I guess, I could tell you guys, I spent $2.5 million when I was in Eastern Pennsylvania putting a system together with microwave links, et cetera, and matrices. And this system in the palm of your hand can do everything that system used to do. So, thank God for Pulsara. I think you could use it anywhere in the U.S., anywhere in the world, actually. But I'm not taking you outside the U.S., but anywhere in the U.S. Am I right?
Yeah, so Pulsara is across the U.S. It's on the East Coast, West Coast, North and South, and then we're also being used in Australia.
Okay. There was a question here. How would you implement your system for smaller volunteer agencies that do not have online medical control available 24/7?
Yeah, so Pulsara, and this is a great question because for Pulsara in rural areas, this is exactly what it allows you to do, right? It doesn't have to be online medical control 24/7. Pulsara 1 is the freemium version of Pulsara. That is free for the EMS services. I say that plural because there may be a number of rural EMS services in your area or fire departments in your area. It's free for EMS. And it's also free to that receiving emergency department. And so what that allows you to do is, in essence, replace the radio report. And so you can use Pulsara not necessarily for your 24/7 medical control if you don't have that in rural areas, but instead the ability to communicate in real time with the community access hospital that you're transporting to at 3 a.m. in the morning.
Yeah, but let me go a little bit deeper. If I was in a rural area, I could contract with somebody. I know a physician, and you know the same physician who is in the Dallas area, and he handles calls in the Atlanta area by his phone. So you could subcontract with a hospital or a provider physician to do your medical control, and Pulsara could make that link happen.
Yeah, and the new advent of I think one of the mainstays that we're going to see as a takeaway from the coronavirus or COVID-19 pandemic is the acceptance of telemedicine in the pre-hospital environment.
Yeah, no question. I think we'll take one last one here. Well, two really. And one is who pays for this? I'll let you answer that first, and then I'll give you the last question.
Yeah, this is a subscription model. It's a great question. It is paid for by the hospital. So the hospital, if you look at kind of the big idea of EMS is possibly making one phone call from EMS to the hospital in the normal transport situation. Like I said, Pulsara 1 for EMS transporting to the hospital is free for EMS and the hospital. It's behind the ED door. So those critical calls where they need the entire trauma team, the STEMI team, the sepsis team, the stroke team. It's a complex environment, and so the hospital pays for the service.
Yeah, and it could even be a consortium of hospitals, am I correct?
Oh, absolutely. There's places and states, state consortiums where an entire state is implementing Pulsara across to their hospitals.
And you know, truth be told, I don't get a penny from Pulsara. I'm just saying this out of my knowledge over the years. That this program's been around for a while and has been vetted through many, many hospitals. So they have total approaches that you can use to get this into your hospital. Once you do a demo with a hospital of all that this does, the hospital is very easy to get on board to help with this. Particularly after all of this with the COVID, this is a great time to strike and ask the hospitals to consider bringing this on board. We're going to wrap it up here with the last question, and that's how does Pulsara fit into rural first responder groups with no transport that rely on somebody like AMR for follow-up with advanced care? How does that link happen, Chris?
Yeah, and it's the same concept as the handoff that we do at the hospital. And so Pulsara is set up so that, and what we're really working on this next version is the EMS to EMS handoff. So the first responder or the non-transporting BLS, emergency responders, or even paramedics that are non-transporting can start the case and then transfer that to the ALS transporting agency and or flight teams. And it's really the same concept of the community access hospitals starting a case and then being able to transfer that case to a larger hospital.
Good. I think we're going to probably wrap it up. I want to tell you that I'm going to invite each of the participants today that come on something new that we have on GEMS called My EMS Today Show, kind of a spinoff of the NBC Today Show, but I don't have Savannah Guthrie or Hoda Coffee. I have my two therapy dogs, Charlie and Cooper. So if you go on to GEMS.com and click, you'll see some very interesting shows that we've had so far. The other day, the Sacramento area was on. Within a week, they put up a community care, community paramedicine program to attack the nursing home areas, and they've impacted 300 patients so far. So a lot of interesting things that I'm trying to do on there. Something like, oh, I wish I could write about that. I'm not writing about it. I'm talking about it. So, you know, on behalf of GEMS, Clarion UX, I'd like to thank all of our speakers today and certainly our sponsor, Pulsara, for today's presentations, how EMS leaders are using mobile technology to manage the COVID-19 crisis and beyond. And as you heard, this is not just a pandemic software. It's something that we bring to your attention, but it's been around for a while and it's going to be around. And almost anything you can imagine linking with your cell phone, you can probably do.